comfortable with who you are.
Question number 12, Mojo Mathers.
Thank you, Mr. Speaker. My question is to the Minister of Health. Did he seek any advice on the effect of raising prescription charges would have on New Zealanders with disabilities? If not, why not?
The Honourable Tony Ryall.
Mr. Speaker, no specific advice was sought on the impact on people with disabilities because in terms of prescriptions, people with disabilities will continue to have appropriate access to the pharmaceutical subsidy card and the disability allowance.
Members of the no, there is no delay. Mojo Mathers, supplementary question.
Supplementary question.
Supplementary question.
Has he considered the financial effect of raising prescription charges for those people with disabilities who are exempted from the minimum wage, given that many of these people work for less than $3 an hour?
The Honourable Tony Ryall.
Mr. Speaker, those people will be able to enjoy the support of the pharmaceutical subsidy card when they get to 20 items, and if they have pharmaceutical costs that are more significant than what would be expected, they are able to access the disability allowance.
Mojo Mathers.
Supplementary question. Has he sought any advice on whether his policy of raising prescription charges will put vulnerable people off from seeking medical assistance, and if not, why not?
The Honourable Tony Ryall.
Mr. Speaker, I think vulnerable people such as those with disabilities should not be put off seeking to get medical assistance, and they should be aware that the moderate increase in prescription charges means that no one need pay more than $40 a year in additional charges. That money is being made available to support other services in the health sector, such as the $133 million extra for disability support services that I announced last Tuesday.
Mojo Mathers.
Question. Will he reconsider this policy if it is shown to be a barrier to vulnerable people, such as people with disabilities, gaining access to medical care?
The Honourable Tony Ryall.
Mr. Speaker, I don't believe that this policy will be a barrier to people seeking care. What we know is that if they need additional support, people can be in contact with Work and Income New Zealand. This government is making support for disabled people a priority. Even in the most difficult of times in a zero budget, this government has made $133 million of additional support services available to disabled New Zealanders, and that is a tremendous commitment.
That, point of order, Sue Moroney, point of order.
Leave to table a document. It's a Mother's Day card to the Minister of Women's Affairs, Jo Goodhue, asking her to support mothers by giving 26 weeks paid parental leave.
The source of this card?
It's signed by about 20 women with baby who are mothers of babies.
The House may want to know where they're from. Or we don't know.
From mothers of children who want 26 weeks paid parental leave.
Leavers sought to table that document. Is there any objection? There is objection. That brings to a close questions for oral answer. I call on Government Order of the Day number 1.